President Obama's new health care plan really socks it to New York taxpayers, and that's bad news for residents for New Jersey and Connecticut as well. Here's CBS 2's political reporter Marcia Kramer.
The numbers are eye-popping. President Obama's plan to tax investment income to pay for his health care package would force New Yorkers to fork over an additional $4.8 billion in taxes, money they get from interest, dividends, and other investments. But here's the rub. A study by the Manhattan Institute finds that New Yorkers will pay 12 to 15% of all the funds raised by the new investment tax. New Jersey residents, 7 to 9%. That's nearly 25% of the entire tax. The hit to area taxpayers is so staggering that experts wonder how our congressmen and senators can support it.
It's like, imagine a giant sucking machine taking dividend and interest income and sending it from New York to Washington, which is not a great thing at any time, but particularly if we continue to struggle economically in the state.
The question is so politically volatile that a number of congressmen didn't return calls to see if they support the president's plan. Chief among them, Congressman Charles Rangel, head of the Tax Writing Ways and Means Committee. At least one Democrat broke ranks.
Taxes on income, taxes on dividends. We are a very high-cost state, so we will pay a larger portion of that burden. So I'd rather have a tax that's fairer, more across the board. Something like taxing the profits of the insurance company, I think, is better.
This is a disaster for New York. It's of all the plans by the president, this is one of the worst as far as the terrible impact and the damage it's going to do to New York.
If this tax is allowed to stand, it will deepen the sea of red ink faced in New York, New Jersey, and Connecticut. I'm Marcia Kramer, CBS 2 News.
The president also wants to increase Medicare taxes for couples who make over $250,000 a year, another tax that hits our area harder than the rest of the country.
Tales of